Coming up on Mayo Clinic Q&A.
An athlete really is anyone who is interested in regular physical activity, participation in sport at any level.
But for people with a heart condition, the thought of starting or returning to physical activity can be scary. That's where a consultation with a sports cardiologist can make a big difference. An initial exam can cover cardiology, cardiac imaging, structural heart disease, and exercise physiology.
That kind of cornerstone test allows us to get a baseline idea of fitness, and also gives us a first sweep of trying to understand where any limitation might be. And then from that, we can go ahead and actually begin to design very individualized training programs. I think that's a really key component here.
Welcome everyone to Mayo Clinic Q&A. I'm Dee Dee Sieben, sitting in for Dr. Helena Gazalka. Sports cardiology is a specialty clinic where a team of cardiologists, exercise physiologists, and other specialists evaluate and treat heart conditions with a goal of keeping athletes active in sports. With us today to discuss sports cardiology are two Mayo Clinic experts, cardiologist Dr. Brian Shapiro and cardiopulmonary exercise physiologist Dr. Brian Taylor. Welcome both of you to the program. Thanks for being with us.
Thank you.
So let's start with, who needs sports cardiology? Is this something that's just for elite athletes, or is this for anyone?
Yeah, that's a terrific question. So I can field that, Brian, first, then you can chime in afterwards. But essentially, we're trying to target three different types of patients. Of course, that elite athlete, whether it be professional, collegiate, or even high school for that matter, we're able to see patients from 15 years and older. And then what we like to call the weekend warriors. So people like myself, who's middle-aged, wants to get out there, wants to start running again, biking, doing triathlons, things of this nature, to those patients who may actually have cardiac disease, have never worked out. Doc, what should I do? One of the main questions I get in my practice is, Doc, what should I eat? And what should I do for exercise? Two fundamental questions that oftentimes we either run out of time in our clinics, or it's not something we have expertise with. And throughout those three different tiers of patients, essentially looking at those who might be healthy or those who may have symptoms that are concerning, whether it be breathing difficulties, arrhythmias, heart conditions like coronary artery disease or heart failure, things of this nature. So we want to see both healthy, but also those who might have issues. Brian, I might let you chime in as well. Brian actually is also the head of cardiac rehab, and so sees quite a few patients who've got quite a bit of cardiac disease.
Yep. Yeah, I think that was a really nice summary of the types of people that we would see through a sports cardiology program. I think perhaps that the key definition here, or the key term to focus on, is athlete. We tend to think of athlete as in high-level, elite, professional sports people, but that's not how we're viewing it here. An athlete really is anyone who is interested in regular physical activity, participation in sport at any level. That can be from, as Dr. Shapiro said, from the elite level down, but all the way to people who just want to take up recreational sports, join a local running team or triathlon team, take part in mass participation, running or cycling events. So athlete is really anyone from the top end, professional, elite level sports person, and that's typically where our minds go to when we think of athlete. But in this terminology, it can be anywhere on that spectrum, and that's something to really remember. This can be anyone who just wants to take part in regular physical activity, take part in a regular sporting event, and kind of get the benefits of being regularly physically active.
Very good. You both definitely touched on some of the reasons a person may want to have an evaluation done by a sports cardiology specialist. So what does a sports cardiology exam involve?
Great question, Dee Dee. So essentially, the most important part of this is not just a me or a Brian Taylor or different components of it. It's really the team multidisciplinary approach that we take at Mayo Clinic, but this is going to be no exception. So essentially, I'll sort of walk you through the typical clinic. So a patient would come to see myself, and I probably would also have a cardiology fellow or a resident with me as well, a trainee. They would see me, get a full comprehensive evaluation. What are your goals? What are the things that might be impediments? Really go through that whole gamut, determine if there are any cardiovascular symptoms that are concerning and so forth. I probably would do some bedside type of, in addition to an examination, probably a bedside echocardiogram. We're going to have labs, ECG, different sort of basic testing, even performed prior to that evaluation. Then we're going to have the patient do what's called a cardiopulmonary stress test. So not just a stress test, and Brian Taylor can speak to this better than I can, but a specific stress test tailored to that patient. So we're going to have a gamut of different testing, whether it be treadmill, bicycle, we'll have weights, we'll have all sorts of different things. Patients would be fit with a certain mask, and I'll let Dr. Taylor discuss that here in a second, where we can measure all sorts of different parameters. That test is going to be performed by an exercise specialist, an exercise physiologist who really knows the way that's supposed to be done and all the intricacies of that. Then they're going to see Dr. Taylor, who's going to interpret the examination, go through all the details of the test, what sort of things they're able to accomplish, what sort of impediments there might be. And at the end of that evaluation, they'd come back to see myself. This is all same day, by the way. Same day, the same visit. See myself for a closeout, and then what other additional things we might need. So we're going to have nutrition with us. We're going to have all sorts of different specialists at our disposal. And there's actually going to be other questions that come up like, Doc, what are my risks? Do I have coronary disease? Do I have some other things where we may need some additional tests like CT scans, stress, different types of stress tests, echocardiograms, a sort of more gamut of different evaluations. Dr. Taylor, I think you might want to speak to the cardiopulmonary stress test and what that entails.
Yeah, perhaps I'm biased because I'm the exercise physiologist on the team, but I really think that cardiopulmonary stress test is the kind of the cornerstone of the evaluation we will do with these patients. In effect, what we do is we stress the system, the human physiological system, to its limits. And what we're trying to do there is really two things. One, we're trying to understand the baseline level of fitness of the overall heart and lung and musculoskeletal fitness the person or the patient has. But it also is like a first sweep of where potential issues might be. Through interpreting these tests, we can understand if exercise is limited. Is it due to a heart condition or a lung condition or something else? Is it just some form of detraining? And so that kind of cornerstone test allows us to get a baseline idea of fitness, and also gives us a first sweep of trying to understand where any limitation might be. And then from that, we can go ahead and actually begin to design very individualized training programs. I think that's a really key component here. We can look at that data, and rather than just using generic data based on things like predicted equations or what we think a person should do, we now have real empirical data as to that person. We can design the best possible training program to get the best benefit for them while maintaining safety. The other element of the exercise testing is as Dr. Shapiro talked about, we'll have a whole range of different tests we can do, different modalities, bike, treadmill, rowing, ergometer. One thing we'll also do is when we work with patients, if they are developing symptoms, for example, sometimes these symptoms can develop in very specific situations. It only takes place after exercising for 30 or 40 minutes at a constant intensity, or it only occurs when someone does very hard exercise intermittently. And so what we'll do is we'll work with the patients to try and develop these kind of unique on-the-spot tests to try and mimic the symptoms they're reporting, so that we can better understand what the cause of the symptoms actually is. So rather than just being stuck with one set of exercise protocols, we can actually be quite specific to the patient, adapt what we do to them to try and replicate the symptoms they're feeling when they become limited, and see if we can identify the problem. And again, that also helps us better understand the patient and better prescribe exercise moving forward.
Yeah, it sounds like these evaluations are very individualized, which is wonderful. So why should a person see a specialist? Can any cardiologist see these patients?
That's a terrific question. So there's a lot of great cardiologists out there, and I would say the vast majority of cardiologists can give the basics. So, the American Heart Association, as an example, puts out a a fairly beautiful statement that says, we need to get our patients exercising for 150 minutes a week. Half that essentially should be more vigorous. They should be doing weight-based training or flexibility type training a couple of days a week. There's all these statements that I think most cardiologists know. Now, that being said, there's a lot of intricacies to exercise. With regards to running, if you're not a runner or you really don't know running, and unfortunately I have the disease, which I say that it's a disease which if you don't know the intricacies of running and biking and swimming and what it takes to sort of be at that high level of, let's say you want to be a football player or a baseball player, or this particular athlete has an ECG abnormality or a heart murmur or something. Can I play Division I sports? There's all these little pieces to that. And I think Brian hit it perfectly too. We can sort of reiterate, in a general way, hey, here's what the American Heart Association says. Or, as you both said, we can individualize it to the patient. Patients are going to be walking out with an exercise prescription tailored to what they want, and then particular follow-up to make sure that things are going along the right lines. I had a professional golf player as a patient the other day. I said to him, what are your goals? And he said, I just want to maintain really decent fitness and stability and strength so I can practice or I can play for the next 20 years. I don't need to be one of these crazy runners or triathletes. I just need my body to hold up. And so we tailored to them. And actually, furthermore, we spoke to his trainer, that works with him every day, and communicate with his trainer and basically say, hey, here's the things I think he should be doing from my end. We talked about some dietary changes. So I think, Dee, overall, I think a lot of cardiologists do this very well. As a team approach, I think we can do this really great and very much individualize it. And I think between a number of us, including myself, Dr. Taylor, all of our exercise physiologists involved, there's a lot of resources to know all of the different gamut of sports. And so I hope that answered your question.
Yeah, definitely. Could you just, I know these exercise prescriptions, as you said, are very tailored, very individualized. Could you give some examples of what types of treatments or programs might be prescribed?
Absolutely. Dr. Taylor, you want to start with this one?
Yeah, I think if I can just take a little step back quickly, sorry, and add to what Dr. Shapiro just said there about the kind of the specialist interest, and maybe this leads into how we prescribe exercise. One of the other reasons for having specialists involved is that there are physiological adaptations that occur specifically in the heart, like the cardiovascular system in general, but specifically in the heart, that the athlete's heart almost kind of paradoxically can look like the pathophysiological heart. So a bad heart and a good heart can actually in some ways, at least on first glance, look quite similar. And so part of our evaluation is to basically help tell the difference between those two things. So what we do not want to do in terms of a prescription standpoint is we don't want to prescribe exercise to someone that is inherent risk of an adverse event. But similarly, we don't want to withhold anyone from exercise when there's actually nothing pathophysiologically wrong. So that expertise, that understanding of how long-term exercise training actually adapts the cardiovascular system and adapts the heart, and looking at and being able to identify the good adaptation versus bad adaptation is really critical. And that's part of the kind of the specialist provision or the specialist service that we provide. And then that leads into the treatment part. And so for me, my role here as the exercise physiologist, will you be prescribing that exercise? A lot of that will come down to what the goals of the person actually is. If this is a maintenance program just to hold where they are, we will look at their current routines and possibly just try and regularize what they do. We'll try and make it a bit more prescribed. Here is, stick with what you're doing, just make it more frequent, do it more often, do it for longer, for example. But if this is someone who really wants to push fitness, wants to compete at a higher level, then we might do things like high intensity interval training, for example, where we push the limits of the cardiovascular and cardiopulmonary system to get better and bigger adaptations. And again, we can then prescribe that exercise very accurately. We can tell the patient what heart rate to try and achieve. We can tell them what speed to run at, what power to cycle at, to get these better adaptations. So depending on what the goal is, we can prescribe anything from almost like a maintenance program where the person will just exercise regularly throughout the week for a certain duration and hold a level of fitness, or we can have them push the envelope, and that's pushing harder on their aerobic exercise, their running, their cycling, really pushing into a higher intensity, adding on resistance training, so lifting weights effectively to get bigger adaptations or better adaptations in muscular strength and muscular endurance to help push performance. And so from an exercise prescription standpoint, that's something what we would look at. If part, and Dr. Shapiro can come back in and probably speak to this better than I can, but if part of the evaluation we see something that does look pathophysiologically wrong, perhaps an irregular heartbeat, some like high blood pressure, we see this fairly frequently in older male athletes, then perhaps there needs to be some combined drug-based therapy to control that irregular heartbeat or control that blood pressure going alongside with the exercise prescription. So sometimes it can be a combined treatment too. And so I think Dr. Shapiro is probably better placed to talk about those drug-based medical treatments than I am.
You look at the numbers of people doing triathlons and running and all this, they're skyrocketing. And so we're seeing that in our 40s, 50s, 60s, even 70-year-olds. We've got other comorbid diseases. And so managing those comorbid diseases, I'll give you an example. I've got a patient who's 72 now, and he's got a very diseased heart. His ejection fraction, or how strong his heart is about 20%, meaning that it's about a third of what it should be. He's dealing with significant cardiomyopathy, but he loves to exercise, loves to be fit. And I've got him on a number of medications, things like beta blockers and ACE inhibitors, special medicines to see if we can shrink up the heart muscle and make it stronger. And so that particular patient wants to do triathlons. And so we basically target exactly what he can do for those particular races. And one time he said, I'm feeling so good, let me take it a little harder. And he actually had a pretty bad race where things went awry. And I said, listen, we need to stick with these parameters and so forth. And as Dr. Taylor mentioned, we've got patients with cardiomyopathies, things with abnormal heart muscle, where we want them to be in good shape. We want them to be physically active. We want those brain chemicals sort of doing what they're supposed to be doing, but with certain limits, with certain ways we treat it. And so I've had a lot of patients with a lot of success. And I know that, if you take a runner, runners love heart rate. It's all about heart rate, and you try blunting that heart rate with certain medications, things are going to go awry. Or what a lot of doctors say when they see an athlete who wants to run and constantly has injuries and this, that, and the others, they say, well, just stop running. Well, I don't know if anybody's told a runner to stop running before, but that runner is never going to come back and see you because, again, it's a disease that we all have. But you have to be able to communicate and meet the patient where they're at. And so there's not one size fits all here. This is going to be essentially a very tailored approach with a very special team of people like Dr. Taylor, his team of exercise physiologists, our nutritionist specialized in sports, a sports cardiologist, and then a number of additional teammates that have specific expertise in this area.
So if there's someone out there listening to this and this sounds like something they're very interested in, how can someone go about finding a sports cardiology center or a physician? Can either of you tell us about what Mayo Clinic has to offer?
I think in terms of finding a program, it is just going to be your general web-based search. The keywords that someone would search for in terms of exercise prescription or sports cardiology or sports medicine would likely lead you to several places that would be viable options for you. But I agree wholeheartedly with Dr. Shapiro said. I think that the real beauty or the real strong sports cardiology groups are those that are multidisciplinary, those that can actually rely upon expertise from multiple different sources. And I'm not sure many centers do that better than Mayo Clinic across the board. We work in teams. There's always open lines of communication, and I can speak to that directly. My immediate background before coming here was in academia, working in universities. And it's a very silo-like environment at universities. You are in your lab on your own and trying to go out and get expert help on an area that maybe you're not quite so familiar is really quite challenging. But that's not the case here at Mayo Clinic. It's not true at Mayo Clinic. So if we were to evaluate a patient and we think that their heart and their lungs are in great shape, but they have a neurological or a musculoskeletal disorder, Dr. Shapiro and I know exactly the people to go to, and we know they'll be willing to help. Same with nutrition. Same with the psychology of exercise. Dr. Shapiro's talked on this a few times in terms of the disease. I think that's also, I don't know if it's a self-selection or a calling, but you tend to find most people, cardiologists, exercise physiologists involved in sports cardiology, have at one time or another been a failed athlete, right? We've all tried and we've not made it, and that's why we're in the jobs that we're in right now. So I don't know if that's a kind of self-selection type deal, but we're familiar with the psychology, the goals, the drive of someone wanting to take part in regular sports and competition is very different to your average patient. And so again, having those expert psychologists on hand to help us work with athletes, especially those who are trying to push on to a higher level, or even those who are at a high level and are suffering performance deficit, they've come to us to try and understand if that's a body thing, when actually it might be more of a mind thing. And again, that multidisciplinary approach. So if someone's searching for a sports cardiology group, I would advise that they look for one that offers a real multidisciplinary approach. And that's certainly something that we can do here at Mayo Clinic, not just on the individual sites, but then between the other sites around the country.
Wonderful. Lots of great information. Thank you both for being with us today. Our thanks to Mayo Clinic experts, Dr. Brian Shapiro and Dr. Brian Taylor, for joining us today on Q&A to discuss sports cardiology.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on podcasts. Thanks for listening, and be well. We hope you'll offer a review of this and other episodes when the option is available. Comments and questions can also be sent to Mayo Clinic News Network at mayo.edu.